Hey everybody, welcome to the ATDev Podcast. We're joined today by our partner and investor, Nick Dobrzelecki. Hey Nick, how you doing?
I'm doing very good, Owen. Thank you.
Yeah, thank you for being here today. We appreciate it. Yeah, so it'd be great. Would you mind giving a little background on yourself for our listeners?
Yeah, sure. So I'm a registered nurse by background. I actually graduated from University of Cincinnati in 1997, and then went into the Army as an Army nurse for a couple years. Got out, moved back into the Ohio region for several years. Worked with Ohio Medicaid waiver program as a case manager. Worked for some home health agencies in various different roles, leadership roles. And then in 2008, started one of my first companies. It was a medical coding company called Daymark. And we were targeting the home health market. And, medical coding outsourcing wasn't unique to healthcare, but it was definitely unique to that environment. And so as we started to develop that company, we built some software to be able to connect the probably the best and brightest coders in the U.S. with our clients. And then we actually ended up growing to the point where we needed so much help that we ended up going overseas. And then eventually, by the time I ended up leaving that company, we were doing about 124,000 records per month.
Wow.
And that was through the coders, but also employing a lot of technology, AI. We were starting to do AI back in 2017, way before a lot of other organizations were.
Yeah, before it was cool.
Yeah.
Yeah, that's great. Yeah, it's so interesting. And so what drew you to entrepreneurship in healthcare?
I'm sorry. What was the question?
What drew you towards entrepreneurship?
Yeah. Kind of seeing gaps in healthcare, seeing where other organizations were not meeting organizations' needs, patient needs. And so it just I started kind of really developing different ideas, the way that I wanted to approach and help solve some of these situations. And the organizations that I work for were great, but they weren't always the willing to kind of take that leap into big projects. And
Right.
so that's what kind of led me into venturing off on my own.
Yeah, yeah, they say necessity is the mother of invention. Yeah. Yeah, very cool. And so, yeah, after you were working on those companies, you transitioned more into the investor role, which is how ATDev connected with you. Can you talk a little bit about how how did you decide to transition into being more on the investing side?
Yeah. So there was really kind of probably two things with that. One, well, first of all, it was nice that I was able to do that with the selling of my last company. But not only did I want to help out other startups because knowing the challenges of a startup is very difficult. And so being able to see like a very, interesting and technology changing solution or product gets me excited. And so to be able to be helping part of that, help mentor through some of that, guide new other startups through some of the challenges and tributes, that startup companies have. So being able to be part of that, and plus, it's very fulfilling for me because I get to learn about new technologies, new areas of healthcare that I typically wouldn't be able to experience, such as the product that you guys have.
Right. Yeah, that's very interesting. I like how it's kind of a full circle and something that, yeah, we really benefited from having you on the team is being able to bounce ideas off you and learn from some of the trials and tribulations you've already been through. And so, yeah, a little bit more on that. How do you approach decision making in a startup environment? And what are some of the values or things that you rely on to help make some of those difficult decisions?
Yeah. I think one of the pieces is really, trying to look in the future, and that's really hard. None of us have a crystal ball, so none of us can really always predict, but to be able to kind of see what the line is to kind of a finished product and how that's going to be helping all the stakeholders that will be using that. The other part of that too is to understand how that product or service may adversely affect other groups also. And
Right.
so to be able to kind of take a look at the kind of holistic aspect of a new offering, that usually is something that I really like because it's kind of like solving a puzzle.
Yeah.
Sometimes the first thought that you have may help certain organizations, but it may, not, help or adversely affect another organization. And so to be able to then modify that service or product to basically do no harm, which is one of the big things that we do in healthcare, and make sure that, it's a morally and ethical, decisions that we're going down. So those are kind of the guiding principles that I have. And usually, if I can make sure that those are in place, then, it's everything else kind of falls in place.
Yeah, I think that's really insightful. And I think, particularly in healthcare, so much of it is based on trust and the human aspect, particularly from a patient perspective. I think there's really there's a human element in healthcare that is vital, and technology can, in our view at ATDev, technology serves the purpose of enabling the humans to do more work and be more effective. And really, the emphasis is not on replacing that human touch because that's something that just can't be replaced by machines.
Absolutely. And, I think once, integrity is so important in, for individuals and for a company. Once your integrity is kind of questioned with an organization, it's hard to come back from that. It's
Yeah.
nearly impossible to repair at times. And so making those right decisions and making sure that, you know, that the if you're going to make some shortcuts, on things, really understanding, what that impact is and how that's going to affect everybody. And as a startup, we have to, move fast and sometimes, cut a little bit of corners here and there, but to do it right and to ensure that you're not harming others is, to me, very important. And it's not even just people outside your organization, it's even your own staff and internally.
Yeah, absolutely. Yep. Yeah, and I think it's definitely a concern that I have with the rapid adoption of AI in healthcare is that things are going to be changing very rapidly in how, I mean, just how data is processed and transferred. I think there's a lot of room for error, and we just hope that the regulations that are in place and the people that are implementing some of these major structural changes are adhering to core ethical principles.
Yeah, no, absolutely. I'm one for, less regulation, but however, regulation and rules get put in place because so many people, don't do things right. And so the more that we can police ourselves and make sure that we are doing ethical AI, meaningful AI, we're putting the right barriers up and using the, clean data. The more that we focus on doing that, then there should be less regulation.
Yeah.
However, as we know, there are always actors that just don't do some of the right things, and and those things will have to be addressed with as this technology continues to evolve.
Yeah, I agree. And yeah, I definitely agree about regulations, especially from a startup perspective. They can be very difficult to deal with when you don't have a massive legal team and you're trying to figure out the nuances of the US healthcare system.
Yeah.
Yeah, which actually I sometimes love to talk about. Yeah, you have a really unique global perspective on healthcare. What are some of the things that you've noticed about, I think, the U.S. healthcare system in comparison to others that may be good or bad?
hmm Yeah, it's been an interesting journey. A lot of learning on my part about the global healthcare market. On some aspects, it's amazing how similar our systems are. The payment systems may be totally different, but one of the core foundations is that everybody wants to do good healthcare, and everybody is very proactive and um, really works really hard for in their jobs, and I see that
Right.
everywhere that I've ever been. The One of the challenges that I've seen and been feeling here in the US a little bit, and probably over the last 10 years, is that the US is getting a little bit burnt out on technology changes and innovation.
Hmm.
It's not that we're not wanting to do that. It's a lot of these organizations are. It's it's a lot of work to implement new innovation and change, and a lot of organizations are just trying to keep the trains running, and so they don't always want to try a new product, a new service. On the international market, I'm just amazed on the number of organizations that will come up to us, and not only are they interested in trying out our solution, they come up and want to collaborate with how to implement this within their own organization, and that has been a bit of a kind of a surprise to me on the amount of excitement there is on the global market kind of versus the U.S. market.
Yeah, that's interesting. So it's almost globally people are maybe more interested in adopting new technology, while in the US there's some resistance to change or to new technology.
Yeah, there definitely has. I definitely have seen that and felt that over probably the last, like I said, 10 years. I've been feeling it in the U.S. with organizations where they really want to see proven models. They're willing to pay for it. They're willing to pay to be a higher rate for a proven service or product versus trying to be an early adopter and get better terms for the long term.
Right,
Versus the international market, they're it's not even so much of a cost for them as much as a how can this improve us, improve our organization, improve our staff, efficiencies, effectiveness, patient outcomes. And so and we're just seeing that anywhere from in Europe, the Middle East, some of the African countries that we've been kind of working with here of late.
that's really interesting. I wonder if it's a cultural shift in how healthcare professionals are being trained here in the US. I mean, it could be a lot of different reasons. I know. electronic medical records have caused a lot of chaos,
Yeah.
and I think that rollout probably could have been better.
Yeah, no, you're absolutely right. And in the early 2000s when EMR rollout, went nationally, to your point, it could have been better, but we were also at a different time for technology. I had to remind people when we first started our medical coding company, we were still faxing medical records from from the
Right.
organizations to us and then back to the organization. And that was 2008, and you would think back in 2008, we would be, have these fully automated systems, and it just was not in place at that time. It was emerging, but it just wasn't there. And that's when all the EMR rollouts were happening. And so there's a lot of, I think, to your point, burnout, from some of that, and skepticism, about, oh, it's a new solution, and it's going to make change, and people just want to see that proof before they try it here in the U.S.
Yeah, absolutely. So, looking forward, what are some areas in healthcare that you see are prime for disruption or any technology that you're particularly excited about trying?
Yeah, no, absolutely. I think one of the biggest areas is the chronic disease prevention and management. That area is still highly fragmented, despite one of the biggest drivers being ensuring patient outcomes and costs are pushed down. We have several different areas over there. You have like wearables, you have software, and there has not been a whole lot of integration in that environment. And so a lot of companies are popping up and they're all trying to create these wearable devices, track your blood pressure, track your heart rate, EKGs, track your weight, to do a lot of different aspects to help kind of manage one or two chronic diseases. However, there's not a whole lot out there right now that's putting all this together. However, with I believe, that's going to be we're going to be on the edge of that. And so I do believe that probably in the next, 5 years, we're going to start seeing a lot better integrated chronic disease management solutions. And it's definitely one area that I'm hoping that other organizations will kind of step up to focus on. And because it is such a, costly aspect of our healthcare, not just here in the US, but internationally. And patient outcomes are just have not, improved that much over the years, with even with all the technology that we've had so far.
Yeah, that's very interesting. One statistic that we always talk about at ATDev is that in the US, 10,000 people turn 65 every day.
Yeah,
And so, yeah, that's just a staggering amount of people that are moving into old age and moving into disability and chronic health issues. And the the burden of being able to make sure that these individuals are maintaining their health is increasing. There's so many people are living longer, and so which is great, and it also provides an opportunity, I think, for entrepreneurs to develop more creative solutions for maintaining their health.
yeah, absolutely. Yeah, and it's to me, it's less about creating stuff that's already out there, where organizations are trying to just make one iteration, two iterations better than the devices or the software that's out there. What entrepreneurs really need to be looking at is the whole environment and trying to figure out how to connect all that together. And I think with AI, we're truly going to be seeing something. And it's such a we've been talking about chronic disease management here in the U.S. like, like ever since I was back in nursing school back in the 90s. I mean, I'm sure it was before that. On the international market, it does seem to be a more of a recent focus. It's not that they haven't been aware of it. It's probably that only been more recently in the last 5 years that they've been actively trying to create solutions for some of that. So it's definitely a huge market. Chronic disease of diabetes, hypertension, heart failure, all that stuff here in the US is the same problems that we see, globally. And it's funny, every country I go to, they're like, "Oh, we have the worst diabetes rates in the world." And but every country I go to says that, right? Now, they're not great, but there's definitely ones that are more offenders than others. But it's definitely areas that everybody's kind of focusing on.
Awesome, Nick. Well, thank you so much for being here today and everything that you have done and continue to do in the healthcare space.
Well, thank you, Owen. My pleasure.
Great. Well, thanks for listening, everybody, and stay tuned for the next one. Take care.